Hey everyone, my name's Emily. I'm a second year at Tulane, and we looked at the indications for a lateral extra-articular tenodesis. Something that we wanted to look at was that essentially these augmentation procedures are added a lot to your ACL repairs, but there's not a lot of literature review on the indications for when this LET should be added. And we thought that understanding that the patient parameters and clinical scenarios where this is useful would be good research. So we did a systematic review using Prisma Guideline, and we looked at the Web of Science, Cochrane, PubMed, and Embase databases. And we pulled for certain indication data, which we realized is a limitation to this study because we could not get all of it. But some of the things that we looked at were positive pivot shift, revision ACL repairs, ligamentous laxity, high-grade graft failure, and sports participation. So as you can see in our graph, this is our data that was quantified, and we just indicated that every time the paper brought up one of these parameters for an indication for this procedure, we marked that down. And we had 463 studies overall that got brought down to 23 included in our final review. We had a total of 2,125 patients, about 47% male, and all of these patients got an LET procedure. We did also quantify our LET by technique. So we looked at our modified McIntosh using Arnold-Kocher, our modified Lamar technique, and then we also did our other techniques that were not quantified or included. The most common indication that we found in this study for an LET augmentation was a positive pivot shift test. That was in 19 of our studies. In 17 of those studies, we did find that it was a grade 2 or higher for pivot shifting, making us realize that this is probably better for a higher grade pivot shift, higher grade instability knee compared to our lower grade knees. The second most common indication for this LET augmentation procedure was a revision ACL repair, which obviously also makes sense considering that someone that is needing a revision ACL repair probably does also have a higher instability knee compared to the ones that are low grade. We also, when we quantified that information and we were looking at the revision ACL repair, we did find that significantly higher rates of the postoperative pivot shift were also included in those revision ACL repairs, pushing more to saying that the pivot shift was the most important indication in this study. And then finally, 11 of our 23 studies recommended that LET would be performed in ligamentous laxity, yet again for that anterior instability of the knee. And overall, what we found from that is that 10 of those 11 studies also had a positive pivot shift testing that was above grade 2 or higher. So our study essentially concluded that if you have a high instability knee with high grade pivot shift, this is probably the best indication for this augmentation procedure. We do recognize the limitations of this study with not all the indications included and not all the techniques. However, this is more coming back.
Oh yeah, it's much better.
But it was
Very good.
it was really popular in the early 2010s, and now it's coming back. So we thought that this information would be relevant for surgeons when considering when to use augmentation procedures like an LET.